you can see by this picture, this is someone who's frankly tongue-tied. Sometimes it presents like this, and sometimes it's not as obvious. But the typical signs of this would be difficulty eating, delayed speech, difficulty in certain sound pronunciations. Now, oftentimes they'll go to the speech pathologist, and the speech pathologist will completely miss this. Why? Because we're not trained either in speech pathology. So I'll have patients like this, oh, I've been in speech for 7 years. I look at them, in 10 seconds I know, well, it's because you're tongue-tied. You can't possibly articulate, you can't possibly eat well, and you can't possibly grow your bones to accommodate all your teeth. So this is a very frank tongue tie. Now here's what's been happening. It's missed by pediatricians, it's missed by dentists, it's missed by pediatric dentists. So it's missed by speech pathologists. And when it isn't missed, when it's picked up, here's the other thing that's happening. So some dentists will just say, oh yeah, I can handle that. Then they quickly snip it or they use a laser, but they have no idea, they're not trained to know, okay, there is a specific way you release this, a specific degree to which you release it with, and then you must go get therapy right away. If you don't, it scars down and it's even worse than when before it's addressed and released. So for releasing this, you want to find the qualified person. You want to make sure that they're trained on how much to release it and that they for sure get you to an oral facial myologist for therapy right after, like days, 1 to 2 days is typical afterwards. Otherwise it scars down and it makes it even worse. The signs to watch out for this are difficulty eating, mispronunciation words, some stuttering, some slow articulation. So kids that don't speak on the critical period of development that we were just talking about, they can have a tongue tie, and that is totally misdiagnosed as well. So it really is something that needs to be looked after. Now, what I'm told is I don't know many orthodontists who are trained in this aspect of what's going on and developing the root cause plan, because you want to direct your thought process, your treatment plan, your diagnosis to what is causing this. Why is this patient coming in with this severe crowding? Why? Why is their speech off? Why do they talk with their jaw, with their tongue down here? I know it's interesting, but that's what they talk like, and you can look at them and see that their tongue is functioning down low. So what you want to do is get to someone who's trained in that. An orthodontist, ideally, that works with an oral facial myologist is the ideal partnership for that. But then you also have to have a partner, and I do have people I refer to for releasing that are specifically trained and that I specifically interview and talk to and make sure that they are trained to know how much to release, where to release, and then to get the therapy afterwards.